about the present vaccination status, who should be taking that, why they should be taking, which conditions are there or when they should be taking it, the different vaccine types that are available for us, the contraindications, and the FAQs. Dr. Vibla will be talking about the registration process regarding the same. So as you can see from this slide, which is released by the ministry just yesterday, when the pandemic began, and this the last figure was May 31st, 2020, we could see that the recovery rate was around 47, like 50% of the people were succumbing to the disease or COVID infection. But if you can see progressively over the months, presently in March, the recovery status is around 96%. But still, the COVID cases are increasing, and there is a high possibility that the second wave is already starting in certain states like Maharashtra, Delhi, and Bangalore. So that is why the COVID vaccine has become very important right now. So to give you the latest figures, like 2 days back, the total number of people who were vaccinated till now is more than 2.5 crores. And on 11th March itself, more than 3.9 lakh people were vaccinated against this COVID infection. So who are the people or candidates who are going to be vaccinated? First of all, it is uh, the vaccine drive began on 16th Jan 2021, and in that the first group of people who were vaccinated were the healthcare workers like doctors, nurses, paramedical people working directly with COVID patients or having interaction with patients, and it also included many other frontline workers like people working in hospitals, sanitation workers, and others. So the second phase of which has begun on 1st March 2021, and it includes senior citizens who are 60 years of age and above, and for people who are in the age group of 45 to 59 with certain comorbidities. So the action plan or the government's plan is to vaccinate at least 30 crore of our population out of the 135 crore by the end of August, and it is a huge task. So ideally, for the group that we are talking, like senior citizens, everybody is allowed to be vaccinated irrespective of their comorbidity status. But many also have their relatives who are in their 40 to 59 or 40 to 60 who need to get vaccinated, but they don't know what are the comorbidities or infections that need to be covered. So beginning with the comorbidities, so these are certain conditions that probably any of your relatives between 45 to 60 years of age is having. They become the candidates for COVID vaccine. Like basically underlying heart condition or heart problems are there, heart failure is there, and they are had admission, hospital admission in the last 1 year. Post cardiac transplant patients or having some sort of cardiac assist devices. Those who are having weak heart, that is their ventricular function is less than 40%, who are having moderate to severe underlying valvular heart disease. Uh, some people who grow up to their uh, elderly age still have certain congenital heart disease, but if there is an underlying pulmonary hypertension, those with coronary artery disease, like patients who have had a heart attack, or they have had angioplasty in the past, or they have had a bypass procedure, and at the same time they are having high blood pressure or diabetes, which is for which they are receiving treatment. Similarly, patients who have had stroke in the past, which is documented, and they are having high blood pressure or diabetes, or people who are diabetic for more than 10 years with certain complications and hypertension on treatment. Other comorbidities are those who have had a kidney transplant or liver transplant or some hematopoietic stem cell transplant, or they are on the wait list for that. Patients with terminal end-stage kidney disease who are either on hemodialysis or some peritoneal dialysis, and some patients who are having certain autoimmune conditions or certain other conditions for which they are using steroid medicines or some immunosuppressants. Liver disease patients, some with chronic asthma or bronchitis, and who have had frequent hospitalizations in the last 2 years, or their post expiratory volume is less than 50. Cancers, blood cancers like leukemia, lymphoma, myeloma, or any solid cancer which was diagnosed or currently they are receiving treatment after 1st July of 2020, and they are having some other bone-related condition or some immunodeficiency conditions, or even HIV patients are eligible if they are between 45 to 59 years of age to receive the vaccine. And for this age group, it is always advisable that you go to your primary care doctor, because for this age group also, to get the vaccine, you have to have the recommendation from the doctor. So, the how do you prevent? Why is this vaccine required basically? So the reason for that is, first, most important, why this vaccine has come is to prevent severe COVID infection and death. It also helps to build herd immunity, because the more the number of people are vaccinated, those who are unvaccinated, they can be protected from this disease, because the virus cannot jump from one person to another. There are no major side effects of the vaccine, and we need to break the chain. It has been almost a year now since the COVID pandemic has broken down. And as rightly said by the government, it is my family, my responsibility. So it is always advisable that if there are any measures which can prevent the spread of the virus, then it should be done. So when do you need to take the vaccine? It is not necessary that immediately today or tomorrow you need to take. There are certain protocols that are in place that need to be followed, but it has to be as early as possible. But at the same time, we need to keep in mind that everyone is there in this country who is going to get vaccinated eventually. So it should not be that you should be rushing and creating a huge load. That is why the government has created certain protocols where people are given appointments. So try to plan it. We have an option what day can be selected. So try to plan it during your less stressful days and when you have no active infection. What are the different COVID vaccines that are available as of now? In India, presently there are two vaccines which are there. One is the Covaxin, which is an indigenous Indian produced in India vaccine by Bharat Biotech, and second is Covishield by AstraZeneca and the Serum Institute. And we're talking about them in some detail, because these are the two vaccines that are available to us as of now immediately. So Covaxin, like I told, it was produced by Bharat Biotech in collaboration with Indian Council of Medical Research and the National Institute of Virology, Pune. So this vaccine is basically an inactivated vaccine. That is, it is a real, it is a coronavirus but has been killed and treated. So that is what is the content of this vaccine. Till now, there was a lot of controversy regarding this vaccine, that the government has hurried into getting this vaccine out since the phase 3 or results are not yet out. But just recently on 3rd March, the phase 3 trials. There are basically four levels or phases of trials or clinical trials. So first is animal studies. Second is in small group of human patients or population. Third is in a larger group of people. And phase 3 trials, that is a larger group of people, has shown 81% efficacy. Now, what do we mean by this is, if the vaccine is given, it has an 81% chance of preventing the infection of the person developing a COVID infection. But that is if the complete dosage of the vaccine is taken. That is, two doses are to be given 4 weeks apart, or after receiving one vaccine, first dose, the second dose is given on the 29th week. So there are certain things that you should keep in mind when you're going for vaccination to the vaccine center, whether it is the Covaxin or Covishield. Try to mention it to the person or the doctor who is there, what all medications you are taking, whether you have any allergy or history of any allergy, recently had any fever, any bleeding disorder or blood thinner was there. Are you having, are you in any immunocompromised condition, or are you taking any medicines for that? Pregnant female, or recently lactating and breastfeeding, or have you taken any COVID vaccine in the recent past? Covishield, like I told, it was developed by Oxford AstraZeneca. Presently, it is developed by Serum Institute of India in Pune, which is the biggest vaccine producer in the world. The difference in this vaccine is basically it is not a killed COVID vaccine. It is a weakened version of an adenovirus or a common cold virus, which is derived from the chimpanzees, not from the humans. But the thing is, it helps in developing a pan antibodies against different strains of adenovirus, and in which coronavirus is also one of the strains which it covers. This also has a regimen of 2 doses. The duration recommended is 4 to 12 weeks according to World Health Organization. But according to our Indian ICMR and the government guidelines, it is given 4 weeks apart, like exactly like Covaxin. The first dose is given on one day, and after 28 days, the second dose is given to the same patient. So here also you have to remember, when you're going to your vaccine provider or the vaccination center, you have to mention the medications you are taking, any allergy, fever, are you on any blood thinners, are you on any multiple medications, pregnancy, breastfeeding, or have you taken any COVID vaccine in the past? So important thing is who shouldn't take the COVID vaccine. Now, ideally, for practical purposes, all elderly should receive the COVID vaccine. Children below 18 years, till now no studies have been done and they are not candidates. Similarly, pregnant and lactating women should not take the vaccine. If you are having any active COVID infection right now or are suffering from active COVID infection, then you should not go for a COVID vaccine. If you have taken a vaccine in the past, I mean a COVID vaccine, and if you have developed any allergic reaction to that, then you are not supposed to take the vaccine again. Or if you have had, specifically with respect to Covishield, it has certain components where people have exhibited allergic reactions. So if any person has developed any severe allergic reaction to any of these components of the COVID vaccine, or they have history of allergy to any of these components like histidine or polysorbate, ethanol, sucrose, sodium chloride, or EDTA, then they should avoid Covishield and go for Covaxin. So these are the strict contraindications or conditions in which the vaccine should not be taken. Otherwise, there is no such condition for which the vaccine is not recommended. There are other strains of vaccine also which are under production and in study in our country as of now. Like we told, Oxford AstraZeneca vaccine is presently being circulated, and it is the predominant vaccine which is being used. Moderna and Pfizer vaccines are RNA-based vaccines. They are presently for distribution in US and other countries. If you look at the chart, the efficacy of each and every vaccine is different. The storage condition for the vaccines are also different. Like the Oxford vaccine, which is available for us at regular 2 to 8 degrees Celsius, it can be preserved and the vaccine is viable. Also, important point to consider is the cost. Like in India, the government has done a good thing if they have kept it a blank. Like if you are taking the vaccine in the government setup or state-run clinic, it is going to be free. But if you are going to take it from a private setup, it is going to cost you around 250 rupees for a vaccine. So for rest everything, if you see, the Moderna vaccine is $33, which is almost 2,500 rupees a single vial. And Pfizer vaccine is similar. It is going to be around 1,500 to 1,600 per dose. And all the vaccines here are 2-dose vaccines that need to be taken over a period of 4 weeks. Zycovid, and these are another vaccines that I'm telling are presently under study in India. They are undergoing some other phases, which after which probably they will also be released. One is called as Zycov-D, which is by Zadis Cadila company. This is a DNA vaccine. Presently, as we are speaking, it is undergoing phase 3 human clinical trials. So it is expected that soon this vaccine will be into the market. Sputnik is a Russian-based vaccine. It is similar to one of the vaccines I mentioned before. It is also a vector vaccine, vector-based vaccine. But here two adenoviruses are used, and this has shown to have better efficiency than other vaccines. And presently, it is in India, in collaboration with Dr. Reddy's lab, it is undergoing phase 2 clinical trial. So once the phase 3 trial comes out, probably then this vaccine will also be available. Bharat Biotech is actually planning one more vaccine, which is an intranasal vaccine. I mean, it does not need to be injected. So it is to block the infection in the nasal mucosa and at the same time to prevent the transmission. Presently, it is undergoing phase 1 human clinical trial. So many patients or many of the elderly have asked me what are the side effects that I can get after I take the vaccine. So it is very important, like we have taken any other vaccine in our life, whatever it is, whether it is a common flu vaccine or tetanus vaccine or DPT vaccine or any vaccine, it is common to exhibit certain symptoms like pain, redness, and swelling can be there at the injection site where you receive it, and it can last you up to 7 days. From my personal experience, when I took the first vaccine dose, I had pain which lasted for 5 days, and it also restricted the mobility of my arm. Tiredness and body and fever and chills are something which I also experienced. For the first time when I took the vaccine, on the second day I got fever and chills for one night. But I had fatigability for probably a day or two. And second dose, I have received both the doses of the vaccine. The second dose when I took, I had fatigability for 1 day after vaccination. So these are the common symptoms which can happen after any vaccination. So it is not a concern of worry. Important thing is after taking vaccine, if you're getting too much pain or swelling or redness, don't over massage that area. Just you can put some cool cloth or cool ice pack compression can be given intermittently. And important thing is after vaccination, make sure that you are maintaining adequate hydration. When some people have a tendency, they try to prevent drinking water. It should be thirst based. And certain committees have recommended to take paracetamol or crocin or dolo 650 immediately after vaccination when you go home, and probably that same evening, and if required, next day on SOS basis. The most important thing is we should not forget the second dose of the vaccine. And is it mandatory to take the vaccine? Many of my elderly patients have asked me. As of now, the government has not laid down any policy where everyone is going to be blanket vaccinated. It is still a voluntary decision based on each and every person's individual thought process. But we have to keep in mind this vaccine is there, which is going to protect us against us. Even if we get infected, it is going to protect us against the severity of the infection. And at the same time, it can help us in decreasing the spread of the infection to our family members and other people. And another thing which is frequently asked is I have suffered from COVID. Do I need to still take the vaccine? Yes, it is very important. I mean, see, this disease itself is very new to us, and we have heard in the news and even in different articles that people who have been infected before are again reinfected with COVID. So it is not yet, it is not sure, or we don't know, like once you get an infection, whether the immunity will be lifelong. Till now, whatever studies are there, they are telling that probably the protective antibodies after an infection can last up to 90 days or 3 months. So after 3 months, a person is again prone to get a second COVID infection. So it is advisable that if you have developed COVID infection, you need to take it, irrespective whether you have had it or not. Ideally, the recommended guidelines by our Ministry of Health and Family Welfare is active patients who are actively infected right now should avoid taking COVID vaccination. But 14 days after your symptoms resolve, you can go for a vaccination. And the grace period is you can wait up to 4 weeks till your vaccine, I mean, after recovery. And then you can go for the vaccination. The reason is it can help in building a stronger immune response. And can we get a vaccine without registration? For healthcare workers and frontline workers, it was direct. We had access to the hospitals and they had a registry and it was possible. But for now, the common public, that is the elderly people and the middle-aged persons, no, you have to register yourself before you go for the vaccination. So many centers have walk-in facility also available, but at that time also before taking the vaccine, the registration has to be done from the COVID app or from the portal. And after that only you are eligible to take the vaccine. One important slide is what documents do I need to carry when I take the COVID vaccine? So you need to take a government photo ID. It can be either an Aadhaar card, voter card, passport, or driving license or PAN card. If you are in the age above 60 years, you don't need a doctor's certificate. But if you are falling in the age group of 45 to 59 years, you need to go to your family doctor and he needs to give you a comorbidity certificate. Then only you will be eligible to take the COVID vaccine. Otherwise, no. It is very important to remember that a vaccine and the COVID vaccine is a good thing, but it is still not guaranteeing 100% protection from the disease. I mean, even the latest study, whatever like I showed in the slide, 92-95% is the efficacy. So there is still a 5% chance of developing an infection. I mean, it may not be severe, but still you can be infected and you can still pass it on to our near and dear ones also. So even if we have taken a vaccine, please do remember that in public places, we need to wear the mask and try to maintain the social distancing and hand hygiene, which we have been practicing for the last 1 year, that needs to be followed. So until and unless we get a cure, we cannot afford to be careless. And we are really fortunate that we are living in a country where, I mean, India is the largest vaccine producer also, but the government has taken a huge step and it has decided to, it has a humongous task of doing the largest vaccination in the world, basically. Like I told before, 30 crore people by August, and each person receiving 2 vials. It is a big, big amount. So we should make sure that we are getting vaccinated, because as of now, this is one of the main protective uh, tool that we have in our uh, pocket, which can help us from severe COVID infection. And with this, I would like to thank you all for listening to me and talk about the COVID vaccination. And here I'll be asking Dudula to talk about the steps that can be taken to register on the portal.
Yes. Good evening, everyone. Our sincere apologies for whatever the accident happened while Dr. Srinivas's talk was on. So, as he has already explained us that why it is important for our population or for you all to take the vaccine, the major query all of us do face is how to actually register for the vaccine, because it is done majorly through apps and websites, and not everybody amongst us is techno savvy or app friendly, or the technology friendly. But we need to do the registration online through the apps. So I'll be giving you a quick uh, I'll just run you through the process of how you can do that for yourself and for your other family members. um, it will be really helpful if you have the app registered or installed on your phone already, because I am showing a PowerPoint presentation. If you want to get an idea, you can follow the steps on your phone while I'm explaining to you. So how to register for COVID-19 vaccine, either on CoWIN app or Arogya Setu app. So if you take the convenience part in consideration, my personal choice always will be Arogya Setu app, because it not only gives you the it's not only merged with COVID, but it also gives you the daily assessment around you and people who are already vaccinated, who are already infected around you. It alerts you on that part, and it is required for people who do travel. My camera is disconnected, but I hope you can see my screen. So step number one, you need to log into the website www.covin.gov.in. When you open the website, you will get on the right hand side, on the top corner of the right hand side, you will see register for vaccination, or you will get an option saying that register through Arogya Setu app. So you can choose whatever you want. If you register from CoWIN, either from website or from the app, you will get, this is a first step. You will see that register for the vaccination. So if you are opening it through your Arogya Setu app, now you will need to update the app first in order to access it. And on the top side, you will see four options. That is your status, your COVID updates, if there are any, vaccination, and COVID. When you select COVID, you will get four drop-down options: vaccination information, vaccination login, register, certificate, and dashboard. So we need to select vaccination, login, or registrations. Once you click on vaccination, login, or registration, this page will open for you. All right, where you have to enter your mobile number. Be very careful when you put your mobile number, because all your SMSs, your dates, and your link for the certification will be coming on the same number. So enter the mobile number which has a good network, and preferably which is associated with other documents such as Aadhaar card. Once you enter your mobile number, you need to select get OTP, and that may take a long time. Okay, the OTP has, you should receive a OTP in 2 minutes, and it is valid for 10 minutes. If you do not get the OTP in 2 minutes, you need to click on resend the OTP. Once you get the OTP in the SMS, it will look like this. It will be generally a 6-digit OTP. Once you get that, enter that number into the page. and click on verify and proceed, right? Once you click on that, your OTP will have to be validated first. So as you said, register for vaccination. You will be prompted, or you will be directed to the next page. On the next page, you can see these many options. So first of all, you will need to select the photo ID proof from the drop down menu they provide you. So the photo ID proofs are included of driving license, PAN card, Aadhaar card, passport, pension book. Pension passbook is also one of the options. Whatever photo ID you select, you need to enter the number into the next column. So if you're selecting in here, if you're selecting, let me just zoom it up for you. Mhm. All right, I think this is more clearer. All right, so here so for example, if you have entered driving license, in the next column you need to put in the number of a driving license. If you have selected PAN card, you need to put in PAN card's number. If you have put in Aadhaar, if you have selected Aadhaar card, you need to put in Aadhaar card's number. If you have selected passport, you need to put your passport number here. And if you have selected your pension book, you need to enter your pension book number here, followed by which you will need to write your name as it is on the card, as it is on your passport or Aadhaar card or pension book, whatever you have selected. Then select your gender, male, female or others. They will be asking you the year of birth. Now, but obviously they need to calculate what age group you fall in, because right now it is open only for a specific group and criteria, no specific age group. Please put in your age very, very carefully in a 4-digit number. And if you have any comorbidities, you need to select yes. As Dr. Srinivas said, if you're 60 and above, you do not need to, they may not ask you, but it is important that you provide if you are going through any, if you have any comorbid conditions existing, accordingly, they will be giving you the vaccination, even whatever age you fall in, 45 plus or 60 plus. Once you select that, you will get a list again of the comorbid conditions you are having. Select that condition and click on the register. Right? Once you register, you will be directed. These are all the details, what I just explained you about. Once you fill all these details in, your name will be added as a beneficiary. Once your name is added, as you can see, from your number or your name in from one mobile number, you can add up to 4 beneficiaries, right? And the process of entering all the beneficiaries is the same. Once you have added all the people, maybe it can be only you, it can be your spouse and other family members. After that, you need to select your name. Okay. This is a beneficiary. Add more is the option on the right side bottom. Once you add all of them, now when you need to schedule your vaccination, you need to select your name. Okay. First, click on the schedule appointment here. Select your name. I'm sorry. Select your name and then select schedule appointment. Once you select that, the pop-up window for the date will open up. You can select the date which is convenient for you. Also, no, this is just a small tip. Keep in mind that you will need to take the next dose after 20 days, 28 days. So have an approximate calculation of your schedule and select the date accordingly. Once you select the date, click on the button for booking vaccination schedule appointment. It will navigate you to the next page. Okay, searches with the vaccination center choice by the state, district, block or pin code will come. So once you select the date, you also will, they will ask you for the PIN code. Enter the PIN code that will lead you to the vaccination center close to your location, right? Once you do that, once you enter the PIN code, they will give you the list of the vaccination centers around you. Select one, select the vaccination center. Then on the right side here, on that particular vaccination center, what are the slots which are available, they will show. They will show the date. On if you select the date, you will get another option saying they will ask you for forenoon or afternoon. You can select one. Sometimes it will be free, sometimes it will not be free as per the availability. Once you select whatever is convenient for you, forenoon or afternoon, select on book, right? Am I running too fast? Do you want me to slow down? Anybody? Just show me on your camera. All right, I'll just go to the next page. Once you submit that entire information, you will get a review page where all your details along with your photo ID card, your comorbid conditions, and whatever date you have selected will come, and you will see this receipt saying that vaccination appointment has been confirmed. And they will also give you the idea of what documents you need to carry. Of course, the document which you have registered, you need to carry the same document, right? For your safety, it's better if you download the confirmation and take it to the vaccination center when you are going to take the vaccine, right? Also, there is an option which I have not showed in my PPT here, that you can reschedule the vaccination appointment. It will again, you can reschedule the appointment from the beneficiaries page. Once you have selected the appointment date, next to your beneficiary name, you can see the option to change the appointment, and you can reschedule. And again, the process is same of selecting the date and time. Anyone has any questions? So because of the accident we have had, we have not given any controls to the participant right now, but if you have any questions, any queries, you just can raise your hand on camera and I'll unmute you. All right, 1 second.
Yeah,
Yes.
after you've taken vaccine, is it still required to put a mask? I've taken first dose of already. Now, should I
Yes.
put a mask all the time after going out, or you can go without mask?
No,
No,
sir.
it is like I told Mr. Jindal, it's a very important question you asked. But even after taking complete vaccine dosage, it is important to wear the mask and follow the hygiene protocols that are there. Because, like I said in my second last slide, the vaccine is going to give you protection to almost somewhere from 75 to 90%. So there is still a 10% chance that you can get the infection.
Okay.
So even after receiving complete dose of vaccine, it is advisable to wear the mask in public spaces and follow the hygiene and social distancing protocols that are in place right now.
And also it is a government's policy that you need to wear a mask even if you are vaccinated. Otherwise, they can charge you a fine. This is also an important aspect.
Okay, thank you.
Mr. Sanjay Kulkarni has asked that, is there any restriction on alcohol consumption on the day or prior or post vaccination? Till now, no studies have been conducted or research is done, but it is yes advisable to restrict your alcohol consumption for a couple of days before vaccination and a couple of days after. But there is no evidence base for it as of now. This is just a suggestion or a recommendation. So if anyone else has any questions, they can ask us. So I think we have covered the basics about the COVID vaccination and the procedures that have to be followed. And with this, then we would like to, if there are no further questions or queries, we can end the session today. So I would like to thank everyone who attended the session, and we are sorry for the initial glitch that was there. And for anyone else who would like to see this recording, it will be available on our Facebook page, and also we'll be uploading this on YouTube in a short while. Radhila, I think you need to unmute yourself.
All right. Everyone, I'm just putting up a small poll. If you can see it on the screen, it had only one question. Do you think it is a relevant and important topic of discussion for you? There are only two options. You just can click on yes or no. Can you?
Mr. Rajesh Senator is asking, is there any restriction on doing regular exercises post-vaccine? I would suggest you can do exercises. There is no restriction as such, but don't overexert yourself. You have to give some rest to the vaccinated arm, because for a day or two it is going to be sore, it is going to pain, and there is going to be some restriction of mobility. So everything is done. I would like to thank everyone for attending this session, and with this we would like to end our today's discussion. And thank you everyone for logging in.